from my peacetime role in the Bureau of Developmental Disabilities. This afternoon, I will moderate and also serve as a panelist at the end of this discussion. Next slide, please. For the next 40 minutes or so, Hillary will provide updates on where we are now, including thoughts about our shared efforts to sustain the continuity of vital services to individuals receiving mental hygiene services, proactive action to understand and support emerging behavioral health concerns for a city facing critical, concurrent health, justice, and economic urgencies, and pointers for remaining heedful, prepared, and fortified to forge ahead as we meet the charge of days and months in front of us. Specifically, after discussing our collective undertakings to respond to the pandemic, Hillary will share updates on COVID-19, discuss behavioral health impacts of the health crisis, and highlight recommended influenza and coastal storm planning and activities. To wrap up, we'll have some time for questions and answers, so please use the Q&A box to send us your thoughts and questions. Thanks in advance to Marnie Davidoff, Gail Goldstein, Mindy Nass, Jamie Nichols, Tina Saha, and Cassie Toner, who will join Hillary and I as panelists to answer your questions. Hillary?
Thanks so much, Janice, and thank you everyone for turning out virtually to listen to this webinar this afternoon. I'm Hillary Cunnins, as Janice mentioned, Executive Deputy Commissioner for the Division of Mental Hygiene at New York City Department of Health and Mental Hygiene. First of all, for this afternoon's presentation, I really want to start with a huge thank you to all of the folks who are calling in virtually to this presentation. You have worked in an extraordinarily difficult time during this pandemic. You have helped sustain and support New Yorkers through the COVID surge and New York City, accomplishing so many great things for the health of people in New York City. You've adapted to virtual and telehealth services with creativity and ingenuity. You have met the many challenges of mitigating COVID spread in congregate and residential settings. You have navigated staffing shortages and maintaining staffing levels for needed in-person work. And I know that you are all working hard, as we are and as the many staff at the health department are, to continue to meet the needs of New Yorkers through all phases of this pandemic. So really, I want to start off this presentation extending a huge thanks and a huge amount of appreciation from all of us, and really on behalf of New Yorkers. Before diving more fully in, I wanted to highlight some of the work that we have been doing in the division to support you, the provider community, and New Yorkers. You can see just a few of our activities with some links, and we will be posting these slides, I should say, after this presentation, so the links will be live and you will be able to navigate from them. We have developed a number of resources, both for yourselves as providers as well as the public. We have an entire web page, coping and emotional well-being page, with a number of different resources. We have launched 2 media campaigns, Stay Home and Stay Connected, and a suicide prevention media campaign. We have also implemented a delivery service for New Yorkers who are receiving methadone maintenance and who are either themselves at risk for complications of COVID or who need to isolate or quarantine. We have been monitoring through our public health surveillance and needs assessment, monitoring population mental health, alcohol and drug use, and behavioral health service use, and you'll see some of these data later in this presentation. We also have a report now that's available online, and I encourage you to read this really very brief and very well-written report, thanks to my colleagues in the epidemiology and surveillance groups here in the division. We also have support directly for providers, including a COVID-19 related practice guidance, documents that describe how to provide New Yorkers support on isolation and quarantine, access to personal protective equipment and telehealth, and some archived webinars on influenza and staffing shortages. And I'll be going over some of those materials today. First, though, let me turn to where we are now at in New York City and in the world in terms of the COVID pandemic. I am guessing that much of this is familiar to all of you, as I know we are all watching the news carefully. Over 1 million deaths due to COVID have been reported worldwide. The highest recent burden of disease has been in the Americas and Southeast Asia. Right now, there are resurgences occurring in several European countries, and cases are on the rise in really the majority of states here in the United States. Locally, New York City public schools, as I'm sure you know, have resumed in-person classes for students who elect to do so, and indoor dining started at a diminished 25% capacity starting on September 30th. However, we have seen here a concerning increase in case counts and hospitalizations in certain areas of New York City, even though we are still seeing an overall citywide test positivity rate of less than 2%. The test positivity rate is one of the metrics that we are following closely to determine the number of tests that come back positive amongst all the tests that get returned. We are working closely across sectors, and you can see in the last bullet is an example of working with schools that are not DOE schools, but non-public schools, to work with them on strategies to reduce transmission. This slide shows our most recent numbers. This is as of last week. And unfortunately, we are nearing to 250,000 of cases here in New York City, nearly 60,000 hospitalizations related to COVID, and more than 20,000 New York City residents have lost their lives to COVID. And as you can see, these data are as of October 14th, so last week. Another extremely concerning part of the pandemic, as we have previously discussed on prior provider webinars, is that there continues to be significant racial and ethnic disparities in who is being affected by this pandemic. And on this slide, you can see the mortality or death rates separated by race and ethnicity since the beginning of the pandemic, and updated as of last week. In New York City, Latinx people, followed by Black New Yorkers, have the highest rates of mortality. This inequity in mortality has shaped both our city's response to the pandemic and prioritizing neighborhoods and populations where we are trying to reach for prevention, as well as early detection and treatment options. I do want to also highlight some of the geography of what we have seen since the beginning of the pandemic. The slide in front of you shows a map of New York City divided by different neighborhoods, with the lighter squares representing neighborhoods with lower case rates and darker purple color representing neighborhoods with higher case rates. You can see that neighborhoods in the Bronx, parts of Queens, and Brooklyn have been disproportionately affected when we look at the course of the pandemic since March. On this next slide, what I am now showing you is the case rate, again by zip code, but just over the last 4 weeks. So as you will see, using more concentrated periods of time, and these data are available on our website, you can determine what zip codes have disproportionate impact more recently. And what you can see, as has been in the news, is the neighborhoods in South Brooklyn have had very high case rates, as well as in darker pink, some neighborhoods in Queens, as well as Far Rockaway. I encourage you to look on our website for additional detail as it becomes available. So what has been in the news really a fair amount over the last few weeks are increases in cases and deaths in New York City. And what you can see on this slide is both lines showing an increase in both cases over the last 4 weeks from about 1,900 to about 3,300. In the most recent week during that period, that represented an increase in cases of 30%. Weekly deaths, which remain relatively low compared to the peak of the pandemic, but nonetheless represent the loss of life of very dear New Yorkers. During this period that ended October 8th, the city saw an increase of 52% in deaths, which resulted in 35 losses in the most recent week. In response to these increases, both the mayor and the governor made the difficult decision to increase restrictions in particular neighborhoods in order to prevent both further transmission within those neighborhoods as well as citywide transmission. As of October 8th, restrictions were placed for both businesses and schools for a minimum of 14 days. The governor designated certain areas of the city, and I will show you the map on the next slide, to be part of a red zone, which means a cluster itself, an orange zone, which means a warning zone, and a yellow zone, which is considered to be a precautionary zone. There are specific restrictions that are associated with each of these zones, ranging from only essential businesses open in the red zone, in the orange zone, closing high-risk non-essential businesses. Schools, as I am guessing you all know, have been closed for in-person learning in both red and orange zones, and yellow zone schools have been mandated to conduct weekly testing. The next slide here shows the 3 areas of the city which the governor has declared as part of these restrictions from the red in the center. The orange zones are a little hard to see, and then surrounding precautionary zones. You can see on the left the nyc.gov/COVID zone for you to be able to find your address and be able to know whether you are located in a yellow, orange, or red zone. So I reviewed most of this just in the slide prior. We do have a fact sheet on the DOHMH on the City Health Department website, and you can very easily learn about the restrictions for schools, businesses, food services, houses of worship, and gatherings by zone. I'll also just point out that regardless of a site's zone or your services zone, you can learn more about reducing risk, including implementing telehealth services during COVID by seeking out either the New York State Office of Mental Health Guidance or the New York State Office of Addiction Services and Supports Guidance, which does provide additional detail and ways of reducing risk for your clients, patients, and staff. I do want to remind you all, as we're speaking about restrictions and changes in practice during this time of increasing cases and increasing concern about transmission. The slide in front of you is what we have come to call the core four to prevent the spread of COVID-19. And the first four items, which I am guessing every single person who is dialing in today could recite as well. Stay home if you're sick, keep physical distance of 6 feet or greater whenever, wherever possible, wear a face covering, keep your hands clean. And the fifth important point is to consider getting tested. The city is now in the fortunate position, through the effort of many colleagues across the city and state, to have testing sites that are widely available and which can be found at the website you see on the slide before you. I want to next turn to what we know about mental health in the context of COVID. First of all, I wanted to make sure that this audience knows about our recent report on the impact of COVID on mental health in New York City. The health department conducted health opinion polls in April and May to learn about New Yorkers' experiences of stress, anxiety, and depression, as well as the emotional or behavioral effect on children. What we learned, and I'll share with you on the next several slides, some of the results from those polls. First of all, using provisional data from our Office of the Chief Medical Examiner together with our Office of Vital Statistics, we have preliminarily identified that 261 suicide deaths took place in the first 6 months of 2020, compared to 270 in 2019. And you can see on the slide in front of you how that looks graphically. So let me just briefly walk you through this slide. Each of the blue bars represents 1 quarter of the year. 1 quarter is 3 months, as you know. And what you can see is each quarter of deaths that occurred by suicide starting in 2015, continuing on through the second quarter of 2020, which is April, May, and June of 2020. So what this slide shows is that there has not yet been observed an increase in deaths by suicide during the pandemic. We are aware, first of all, these data are provisional and could change, meaning that more deaths could be determined to be from suicide as the medical examiner completes the data set. And we also know and want to be vigilant that sometimes the effects and mental health effects of a disaster, including this pandemic, can be delayed. So we are vigilantly monitoring suicide deaths and will continue to provide data as we have them. On the next slide, I want to share with you some of the additional results that we have for New Yorkers' mental health. As I mentioned, the health department surveyed New Yorkers using a health opinion poll method, asking about a number of questions about New Yorkers' experiences during the COVID pandemic. We asked from the division whether New Yorkers had symptoms of anxiety related to the coronavirus in the past 2 weeks. In that survey, 44% of adults reported feeling symptoms of anxiety related to coronavirus. Additionally, we asked adult New Yorkers about symptoms of depression over the past 2 weeks. More than a third of New Yorkers reported symptoms. Just to remind you, these were conducted surveys during April and May, when we were still seeing very large number of cases. We will repeat the survey sometime in the future to see how people are doing, particularly given the many efforts that are underway. And last, but by no means least, we asked adults about whether they had seen a negative impact on children's emotional and or behavioral health. In these surveys, about a third of adults with children in their household report that their children had been, or at least one child had been negatively affected by the pandemic. We know also that there are a number of factors that place adults at risk for adverse mental health consequences. And these risks vary across race and ethnicity and are related to baseline factors around structural racism, income inequality, and other factors that place people of color at particularly high risk for poor mental health outcomes. What we found, as you can see, among the 3 factors surveyed, feeling cut off or distanced from people was most commonly experienced by Latinx New Yorkers. New Yorkers overall 41% of them report a job loss or reduced hours. And this was, again, most common among Latinx New Yorkers, followed by Asian New Yorkers. Finally, we also asked whether New Yorkers were experiencing overwhelming or above average financial stress. And here we learned that, again, Latinx New Yorkers were most likely to report this experience. On the next slide, we also wanted to share with you what we found in terms of the use of mental health services. In May, and this was in May, we learned that 14% of adult New Yorkers reported an unmet need for mental health services since the stay-at-home order was implemented. I'll just editorialize that this was lower than one might have expected given the very high prevalence of experiences of anxiety and depression that we also found. In April, we asked adult New Yorkers whether they had difficulty accessing mental health services for a child during this period, and that number was just about the same. We also tried to measure use of mental health services in a number of other ways. One way that we track the use of possibly inappropriate services is to look at emergency department visits, knowing that with good outpatient mental health care and access to good mental health care, that perhaps these emergency department visits could be averted. Nonetheless, and I'll talk you through this graph in a moment, or I'll talk you through this graph here, is what you're seeing is starting January 1st on your far left, that mental health emergency department visits were about what they were in the prior year, the 2019 average, and that is what the dotted line says. Starting in March, what you will see is a precipitous decrease in emergency department visits with a gradual increase through June. That is, the pandemic and the stay-at-home order resulted in lots of people not seeking care in emergency departments, with some but not complete recovery to 2019 average. On the one hand, we aim to strengthen outpatient and routine services to prevent unneeded emergency department visits, but seeing a graph like that also wants us to be sure that people are continuing to get the mental health help they need. And much of the work that you all are doing with telehealth, virtual health, and keeping your doors open helped to maintain continuity for New Yorkers. Another key service that, as you are likely familiar with, is that of New York City Well. NYC Well is our crisis and help and referral line. And what you are looking at now is a graph of NYC Well contacts, answered contacts, since January of 2020. And again, the same as in the prior slide, the dotted line represents the 2019 average. So what you can see here is that earlier this year, prior to the pandemic, answered contacts were actually lower than in the past year. We saw a spike up in March with the surge in COVID cases, and though that spike came down, it continues to remain elevated above 2019. So we know people are reaching out for help and getting the help and referrals they need, in part through NYC Well. The next slide is drawn from the CDC's national survey of mental health, substance use, and suicidal ideation during the COVID pandemic. I encourage you to have a look at this freely available report where the CDC surveyed about 5,000 adults across the United States. And their findings are very similar to the ones that we found in New York City, with a high prevalence of anxiety symptoms, depression symptoms, as well as trauma and stress. Of note, they noted that more than 10% of adults started or increased substance use to cope with the pandemic, and we are aware that stress can change people's substance use and also patterns of use given the directions to increase physical distancing. I want to remind all of us that we can help clients with changes in substance use during the pandemic, and we have put out some resources to help remind all of us some strategies to do that. You can ask your patients about how they are using alcohol and drugs and whether that has changed during the pandemic or as a consequence of the pandemic. We have some guidance around something called mindful drinking, which is a strategy to reduce the consequences of alcohol use and supporting providers to speak with patients. We encourage you to remember to offer medication treatment to your clients with opioid use disorder, in addition to other strategies that you may also be employing. We have been particularly concerned during this pandemic how changes in tolerance to opioids, that is, how the body is accustomed or not accustomed to opioids, might affect overdose risk. If people are using less or fewer opioids because of difficulty accessing opioids or because of attempts to cut back, they may well be sort of paradoxically at risk increase for overdose if they return to regular use and their body is no longer used to the opioid. Finally, we are asking providers to inform patients that they can obtain naloxone, the medication that reverses overdoses for free from participating pharmacies or community-based programs. And again, I'll remind everyone that these slides will be posted and these links will be live, and you can find these lists and resources. Turning now away from mental health, but issues that I know are relevant for mental hygiene providers. And these are ways that you can help keep your clients and staff safe. First, let me just talk about personal protective equipment. And if you have not thought about ways to stock up, I really encourage you to do so now. The New York City Emergency Stockpile is no longer supplying most New York City partners because the supply chain has considerably loosened. We encourage you to contact your usual suppliers for PPE, and if you do not have usual suppliers, we have posted a list on our website. At the same time, we are continuing to encourage everyone to conserve or to continue to conserve PPE in order to optimize the supply. As we've been discussing, we encourage the ongoing use of telehealth where appropriate, as well as environmental changes that can help keep staff members safe, including installation of physical barriers at reception areas, limitation of healthcare workers entering rooms or offices, use the PPE that's recommended by the New York City Health Department, and consider conserving PPE through what is called reuse and extended use. These, again, are live links, and you can obtain more details there. If you are interested, the CDC has got excellent guidance for optimizing PPE use, easy to read, and I encourage you to have a look there as well. Another topic that is so critical for this time of year, always, but in this year, in the context of the pandemic, the influenza or flu is particularly important. The issue for us is that influenza, the virus that causes the flu, is expected to co-circulate with COVID-19 this season. Flu season is beginning now. We are encouraging all of you to be the messengers for your staff, for your clients, to consider getting a flu vaccine. The flu vaccine is part of a comprehensive public health strategy. It can reduce the overall burden of respiratory illness in New York City. It can protect individuals at greater risk of flu-related illness and complications. And getting a flu vaccine can also help protect the healthcare system and other infrastructure so that patients may be effectively cared for. We recently issued our annual flu vaccine recommendation guidance, and the information is also in that guidance. As you likely know, all people 6 months and older are recommended to get a flu vaccine, including infants and young children, people who are pregnant, people who are older than 65, people with particular underlying medical conditions, which you can see here, and people who care for individuals at increased risk for influenza complications. Often, behavioral health care providers are not called out as people who care for individuals at increased risk for influenza complications. But in this context, for all of you in the behavioral health and intellectual disability and intellectual and developmental disability sector, I want to really emphasize that behavioral healthcare workers are those healthcare workers who can really make a difference here by getting vaccinated. In addition, this season, we are also prioritizing additional groups for vaccine, and you can see these priorities here. Those at higher risk for severe COVID illness, and essential workers. I've mentioned all of you from the mental hygiene sector, but I also want to call out nursing home, long-care facility, and pharmacy staff, as well as critical infrastructure workforce, particularly if their jobs require regular interaction with the public. So what I also want to share with you is that healthcare worker recommendation is the strongest predictor of vaccination. And I encourage you to tell your patients, clients, participants that you consider vaccinations, including the flu vaccine, to be one of the highest priority health protecting steps you can take. Another strategy is to explain why you and your family get vaccinated against influenza each year. I have been wearing in public I got the flu vaccine just to model and spread the word in every way that I can. Access to flu vaccination is fairly widespread, is available for many primary care providers. It is covered by most insurance plans and is available at no cost under the Affordable Care Act, though there may be a copayment for office visits and out-of-network provider restrictions. There are many options for people without a primary care provider and for people who are not insured. The sites that you see on the slide in front of you include places like federally qualified community health centers, all New York City health and hospitals facilities, as well as many urgent care centers. We are aiming to support providers and New Yorkers to find flu vaccines. And on our website on the New York City website is the New York City Health Map, where you can search for low-cost or free flu vaccination services. You can call 911. You can text flu or gripe to 877-877, or you can visit nyc.gov/flu for a list of community events. And last, but by no means least, I want to remind everyone that it is still coastal storm season. Though it ends typically at the end of October, we have been busy at the health department making sure that we are prepared to support New Yorkers. And in part, it does feel like one more thing on top of one more thing on top of the pandemic. But I encourage all of you to think about coastal storm preparations, if not for this year, for the future. What you may already be aware of is the mayor can mandate, in the context of a coastal storm, that residents of specific zones or communities leave their homes for the protection of their health and welfare in the event of an approaching storm. Why might this be important to all of you? Your staffing plans should take into account the possibility of an evacuation if your site or your staff live in the hurricane evacuation zones. We encourage you to keep up-to-date contact information for all your staff, including emergency contacts, should services need to change rapidly. Additionally, healthcare facilities, including behavioral healthcare facilities, should develop coverage plans in case that staff who may need to evacuate cannot come perform their usual job duties. I encourage you for both your site, your provision of services site, as well as for all of your staff to know whether you are in a hurricane evacuation zone and which one in order to make best plans. So my huge thanks for listening in this afternoon. I'm going to turn us back over to Janice Chisholm, who is going to field some questions. I encourage you to type any questions, and we'll get to as many of them as we can by typing them into the Q&A box. Janice.
Hillary, thanks as ever for grounding us. This important information is helpful for keeping us mindful as we continue to push forward in our work to secure New York City mental hygiene services in these troubling times. Thanks also for pointing folks to the Q&A box. Thus far, I think we only have a single question, but once again, we're inviting listeners to use the Q&A box to let us know what's on your mind, and we'll do our very best to answer as many questions as time permits. Note that if we don't get to your question today, we are asking you to follow up with your DOHMH program specialist or consultant. And also note that we will be sharing today's presentation and making it available to you at a later time. So let's turn to your questions, and reminding you that we have panelists Cassie, Gail, Hillary, Jamie, Janice, Marnie, Mindy, and Tina. So thanks to each of us. The first question, and thus far the only question that I'm noting, is one that's coming in with regards to the rapid tests. Can a not-for-profit who runs schools get access to the rapid tests that the state provided to the New York City Department of Ed in order to comply with the 20% testing requirement? And I think this one should probably go to Hillary. I can say just off the top that I know there are ongoing discussions about the distribution strategy and protocol for the tests, but Hillary, I think you may know more.
Yes, and I should just, thanks for the question. Let me encourage you, or let me just set this up as follows. New York State did provide rapid test kits that will be available to schools in the yellow zones to accomplish the mandated weekly testing. There is a guidance on the New York City Department of Health website about how to request those tests. Schools that would like rapid testing do need to have a healthcare provider to both collect the specimen and to be able to run the test, which does not require a special machine, but does require some reagents and mixing material. So that guidance is up on our website. That said, DOE, Department of Education, the public schools in New York City are undertaking their own procedures, and DOE is supporting schools with their testing procedures in a slightly different way. And so if the person can get online, I think that will be clear if she is from or they're from a not public school, and if from a DOE school, they should reach out to DOE.
Thanks, Hillary. And I'm going to ask colleagues who are helping us to person this webinar to put any other questions forward, because I am actually not seeing any questions in the Q&A box. And again, reminding our listeners that we are waiting to hear from you. What's on your mind? Tell us if there are questions or concerns that we can address in the next few minutes. And again, asking those who are helping us to administrate whether or not you're seeing questions that maybe I'm missing.
We've received one other question, which I'll go ahead and read. Currently, agencies have implemented a questionnaire that screens for COVID-19 symptoms prior to staff or guests being allowed to enter the facility. COVID-19 symptoms are similar to flu and allergy symptoms. Is there any guidance on addressing that distinction?
Yes. I think I can probably take that one as well, Janice. I appreciate the question very much, and I think in particular, I'll tackle the flu question. And the reason we are so concerned about the flu is it's really not possible to distinguish on the brief questionnaire flu from COVID infection. And so persons who have flu-like symptoms should be excluded from coming to work that day or from visiting a facility. One strategy is to encourage them to see their provider, and there are rapid flu tests as well as we've just mentioned, COVID tests. If there's any concern or doubt that the illness could be due to COVID, the safest thing is to get tested and to stay home until those results are available, and to separate or isolate. I do know that allergies can be a bit tricky. Allergies are sometimes associated with itchiness, which is atypical for COVID, but I encourage programs with any doubt to advise the person to seek medical attention in order to really be sure that they are not bringing COVID illness into the facility.
Thanks so much, Hillary. And do we see any other questions? Oh, I think I just saw one. Can you speak more about the lack of use of the EDs during the height of the pandemic, the emergency departments? Were the needs of people who typically turn to the emergency department adequately covered by other services? That also sounds like a Hillary question.
Sure. That's a great question, and I think this is something that we are speaking with many of you about as well. I think we have some uncertainty about whether needs were sufficiently met. We do, as you saw in our health opinion poll, got reported back that there were actually relatively a relative minority of people reported unmet mental health needs. But that said, it's hard to look at the emergency department graph and feel confident that all the people got their needs met. And that is why it is so important for all of us delivering services to folks in need of mental hygiene services to do as much proactive outreach and engagement with clients and participants as possible. We have been aggressively promoting NYC Well as another means to gain access to support 24/7 by text, chat, or call. And so really, we are really working together, and I am enlisting all of you to help us do the kind of outreach and awareness of services that do exist, even when folks are nervous about going or seeking care in the emergency department. I will say at this point that emergency departments are safe. There are excellent safety procedures available, and that is also true of outpatient physical health. We want people to seek and get the care that they need. We know that folks are still afraid, we suspect that folks are still afraid of coming into healthcare settings, and we are urging, including Commissioner Chokshi, our health commissioner, encouraging people to seek needed care, whether it's medication management, vaccinations, and other preventive services. Janice, I see another question about supportive housing. The question is, with supportive housing, would you recommend daily reminders for tenants to get the flu or COVID testing? Would you mandate it for residents who are under DOHMH? So thank you for that question. We have not mandated daily testing in any sector, and just we are encouraging it. And I'm guessing, although I don't know if the questioner means this, I assume that means flu or COVID screening with a brief questionnaire. So lots of employers, and it would be easy to implement either paper or via a phone, a quick questionnaire that just is a quick screener for not feeling well. And you can find examples of this on our website. And I would encourage programs to implement this, and for supportive housing to implement it gently and voluntarily as a way to help people stay in touch with whether or not they are feeling well.
Thanks, Hillary. There's also another question. Are these presentations provided to small groups in the community like faith-based organizations to discuss mental health options? Is this on the website?
So we, thank you for the question. That is from Lauren Campbell. We do have presentations available for small groups. We are calling them 3C, Community Conversations About COVID. And they speak about mental health recovery, reactions to the pandemic, and we would be happy to do those presentations. And let me, while we're talking, see if we can get you a contact for that and put it in the chat box.
Thanks again, Hillary. Please continue to put your questions in. We have another few minutes if there are any questions that folks would like to bring forward. You can use this time to address those questions. And again, we will be sending the webinar so that you'll have this information for your use going forward. I'm not seeing any other questions. If any of my colleagues are seeing questions that I'm missing, please feel free to bring them forward.
Well, Janice, let's then close. And for the last question, what we will do is put a slide when we post this presentation to say how community groups can request a presentation for our 3C program, and we would be very happy to do that. And I thank you for your interest in that. So go ahead, Janice, sorry.
Well, I was just going to say thanks again to you, Hillary, for giving us such vital information, and thanking our partners once again for their partnership, and especially for the ongoing strivings to provide quality mental hygiene services for New Yorkers. I do think there may be another question if we have a moment to look at that. Can a professional worker with pre-existing conditions continue working from home while the pandemic? And I guess that means during the pandemic. Hillary, if you want to take that one, or we can add it now that we're actually running out of time, we can add it to responses that we provide with the webinar. Your call.
Sure. I missed the exact question.
So it reads, can a professional worker with pre-existing conditions continue working from home during the pandemic?
Got it. So so that's an important question, and I encourage you to speak with your employer and your human resources at your agency. We are aware that some of the pre-existing medical conditions for COVID make someone eligible for accommodation according to federal law, but that is a question that, again, is outside of the jurisdiction of the New York City Health Department, and I encourage you to speak with your own agency about that. And I'm just getting a little bit of information about the community presentations, and I think Leah Rosales is putting some information in the chat, but we will add that to the slide deck when we post it.
Yep, and I think it's now time for us to close. Hillary, thanks again, and thanks to all of you who are listening, and we wish you that you will be well, stay connected to your safety, and please use this very important information to the advantage of all the New Yorkers whom you serve. Thanks again for your partnership.